I'm ready.
Hi, my name is Samantha Walker. I'm here to do my video for NG tube insertion. The first thing I want to do is go ahead and review my order and check the patient's history of surgery to see if they have had any type of oral or nasal surgery. The next thing I want to do is go ahead and provide privacy for my patient, perform my hand hygiene, and I want to go ahead and introduce myself. So, hi Mr. Walker, my name is Samantha. I'm here to insert your NG tube today. Have you ever had this procedure? You have? Okay. So, I would go ahead and explain my procedure to the patient, let him know that when the tube touches the pharynx area, that he needs to establish a stop signal with me. At that point, I'm going to go ahead and give him his water so he can swallow, and the tube will go further down. I do want to assess your abdomen today, and we're going to see which side of your nose you prefer. Can you touch your finger to your nose and tell me which side is clearer? We're going to establish the patency of the nares to put the tube down the side that is more clear. The next thing I'm going to do is go ahead and pull down the covers and have a look at his abdomen. I am going to go ahead and put on my gloves. The abdomen looks normal. I want to look for distension when I'm assessing it. I'm going to ask my patient if he has any areas of pain. I am also going to go ahead and listen to the abdomen for bowel sounds in all 4 quadrants. I would listen for up to 2 minutes in each section. 5 if I'm not hearing anything, and then I would contact the physician if there was an absence of bowel sounds. Okay. Alright. I'm going to go ahead and prepare you for the procedure. And what we're going to do is I'm going to put a towel on his chest. I'm going to raise the head of the bed to the half Fowler's position. Okay. At this point, I may change my gloves. I do want to ensure that my hands are clean. So, just going to verbalize that. I want to go ahead and measure the tube. And I am going to start with the tip of his nose, go to his earlobe, and then down to the xiphoid process. So that looks like that's right around 50. I would document this. You could use a marker to mark the length of the tube, or you can use tape. Our tube usually only inserts till about 30 on our mannequin. So the next thing I want to do is go ahead and lubricate my tube 2 to 3 inches. And I'm going to give my patient the water. Alright, are you ready? Okay. Remember to let me know when it touches your pharynx. Okay. So the tube is at the pharynx. Give him his water. His head would be flexed back slightly before tube insertion. At this point, I'm going to have him move his chin forward and take drinks of water while we continue to insert the tube, because drinking the water helps the tube to go down. Okay. Okay. And that's where our tube generally stops. I am going to clamp off the end of the tube, and I'm going to go ahead and secure the tube to his nose. I'm going to ask him if he's doing okay. Observe his respiratory rate to make sure there's no breathing distress. I'm going to go ahead and verify placement of the tube by measuring the pH of the aspirate. So I would aspirate the contents of the stomach. It looks like the stomach contents have stopped now, and he's right at 40. There isn't anything else coming out. So I'm going to go ahead and put most of that back in here so we can just have a little bit for our pH strip. All right, the pH is less than 4. The appearance of the aspirate is yellowish greenish, which is stomach level. So I'm going to put the stomach contents back in. Okay, and then at that point we're going to have an x-ray to ensure that the tube is placed correctly. So then I want to go ahead and measure the tube from the tip here to the end so we can document that. You never would reposition a tube in a patient because if they have a surgical incision, it could cause that to reopen. So I'm going to go ahead then and connect this to the suction. So, but first I want to go ahead and attach it to his gown. Okay. The next thing we're going to do is ensure his comfort. How are you doing? And he seems to be doing okay. We want to document how the patient tolerated the procedure. We also want to provide some oral hygiene care for him to be sure he's comfortable. I am going to go ahead and remove my gloves, do my hand hygiene, and put him in a comfortable position. Give him his call light back and clean up my area. So I would document the procedure performed with the tube length and how the patient tolerated the procedure. Thank you.